We will go to our last presentation, really running out of time at this point, but I want to call on Ndola Prata to give her presentation. Ndola.
Thank you so much, Alex. I'll try to keep on time, but you know me. So I wanted to thank the workshop organizers for allowing me to participate in this workshop. And my presentation today will focus on the nexus between fertility, family planning, and empowerment. And I'll focus specifically on adolescents. Next. So a quick overview, I will start by looking at fertility and contraception in low and middle income countries, then discuss a little bit the importance of empowering adolescents for sexual and reproductive health and rights. We all know, because we all were adolescents at some point in time, and remember how important time in people's lives that is when young people experiment with independence, they forge new relationships, develop new social skills, and learn new behaviors. So it is important that if they are engaged in meaningful ways and supported in all aspects of their lives, adolescents are more likely to experience a healthy transition to adulthood. And sexual and reproductive health is a big part of that potential for healthy transitions. Next. So very quickly related to fertility, the UN report on adolescent fertility since the ICPD in Cairo shows that birth rates have declined since 1990. But as you can see in the graph next to in the top corner, you'll see that there's still significant differences across regions in the world, with sub-Saharan Africa being the part of the world with the highest adolescent birth rates. And it is also important for us to remember some key facts about adolescent fertility. The decline in adolescent fertility, although established almost everywhere, is slower than the total fertility rate for the entire regions in some areas. It is also important to note that the sexual initiation before marriage is almost universal. And not all childbearing in adolescence is intended, even among those who are married. There are high levels of adolescent fertility that are associated with a high proportion of unsatisfied demand for family planning. And early marriage remains a very strong underlying factor for high adolescent fertility. But it's also important to note that longer school duration, so the longer the girls, especially for the girls, that they stay in school, the lower at the population level we'll see levels of adolescent childbearing. Next. Next slide, please. I just wanted to show you this framework that has been part of my work for quite a bit of time at the Bixby Center at UC Berkeley, and also with the Innovations for Youth, also at UC Berkeley. And in this framework, clearly identifies the key drivers, the poor outcomes, and also the underlying causes influencing adolescent sexual and reproductive health. It also helps us understand where programmatic interventions can make a difference, in addition to force us to look more deeply into the social determinants, specifically for the determinants for adolescent health. And for example, those are the key, if you take the drivers, the box on the drivers, those are the key aspects. But if you compare, for example, two countries, Angola, where I was born, and Niger, where I work a lot. For example, in Angola, child marriage and female genital mutilation is less of an issue in terms of harmful practices than in Niger. But the lack of contraception that is so highly prevalent in both places leads to similar outcomes in terms of reproductive indicators for both countries. Very high fertility, very low contraceptive use. But it's also important with this framework to look at the gender norms and empowerment that have been increasingly recognized as key influencers for adolescent health and specifically for adolescent sexual and reproductive health that I will talk a little bit more about during this presentation. Next. Now, I just also wanted to remind us that according to the UN Pop Division, the World Population Policies Report showed that there is an increased concern by governments in low and middle income countries in terms of recognizing that adolescent fertility is a major concern. Next. However, despite that recognition that governments had related to adolescent fertility, comprehensive sexuality education is not universally available. And even though there is evidence that contraception is the key to achieve declines in teenage pregnancy, in most low and middle income countries, contraceptive use is low for adolescents. There are various estimates of unmet need for contraception available, but they all expose a very bad picture of what is happening regarding contraception for this particular group of people. So, for example, Guttmacher estimates that in developing countries, of the 38 million female adolescents in need of contraception, less than half are using modern methods. Deeth and Stark, in their review in 2019, they also estimate around 23 million girls, 15 to 19-year-olds in low middle income countries have an unmet need for contraception. So even though we have sometimes different figures, but it is important just to note that planning for future contraception needs for a growing segment of the population is key to achieve the overall better reproductive health outcomes. Specifically, decrease unintended pregnancies is well documented by Biddlecombe et al. In 2018, but also to decrease unsafe abortion, something that some of the previous speakers already alluded to. Next. My colleague and I sort of put together this as part of our work with adolescent sexual and reproductive health, put together this framework that looks at the adolescent contraceptive journey. So we did find in the literature that even among adolescents, there are differences in terms of access and utilization between those who are unmarried with no children, those who are married without children, and those who are married with children. And when you put together sort of all of the micro, meso, and macro factors that can affect whether or not these three important subgroups of adolescents can have access, then you come up with the importance of looking at specific aspects of where can we intervene, how can we intervene, and for example, by looking at, for example, what factors can affect an unmarried with no children when it comes to access to contraception, what probably will have higher restrictions, because given the social norms and the wider part of the wider environment might not be able to access as easily as an adolescent that is married with children. But those social norms can also bring different aspects of in those restrictions. While for the unmarried with no children, it was like, why do you need contraception? You might have more problems even talking about contraception because the expectation is that if you're unmarried and have no children and you are an adolescent, you're not even supposed to have sex. While if adolescent is married, the idea could be in terms of gender norms and in terms of restrictions in access to contraception, that why do you need contraception? You're young, you're starting to have children, you should continue to have children. And we find in many places, like again, the example of Angola and Niger, that they continue to have children without using contraception until they reach a desired family size. And then they start thinking about using contraception. Next. Now, I want to transition to time transition quickly to empowerment. And we've heard about measurements, the challenges in measurement. They all translate into also when we try to measure adolescent empowerment. Different approaches have been used to with the intent to improve empowerment among adolescents, from asset building to economic cash transfers to continued school, etc., attitudes, capabilities, some conditions and opportunities. But I want to focus our discussion today in something that sometimes is it's not a lot discussed in related to empowerment, that which is youth participation. So youth engagement and participation has been framed mostly around civic rights. But I think that there is also an increasing understanding of the importance of meaningful adolescent participation in sexual and reproductive health policies and programs. Even though a lot more needs to be done, I wanted us to just discuss a little bit the linkages. Why is this important? I want to share that with you. Next. So the UN establishes that adolescent participation is a fundamental right, and required that boys and girls, individual or collectively, are sort of exposed to forms and express their views and influence matters that concern them directly or indirectly. And they actually group into 4 categories of participation, but the one that I wanted to focus a little bit more today is the participation in relation to empowerment, that I think has important linkages to sexual and reproductive health. Next. So the features that they propose as meaningful adolescent participation goes all the way from looking at safe spaces to an inclusive opportunity, to voice in terms of expression of their view, to the audience where they feel that they're listened, all the way to the view, to the influence, so that their views actually can influence decision making and produce some impact. All of them interconnected or feeding into each other. Next. Now, they look at adolescent participation in the 3 different categories of empowerment: the empowerment within, related to self-efficacy, confidence, knowledge, dignity, self-worth, and recognition of entitlement. Some of it we talked about, not specifically to adolescents, we've talked about also yesterday, but the empowerment with, and we talked about yesterday a little bit related to communities, building partnerships, collaboration, solidarity. But one that is extremely sort of important for the sexual reproductive health aspects that we're discussing today among adolescents is the empowered to challenge violations that we do exist in sexual reproductive health, that they can influence decisions affecting them. We're talking about decisions, for example, related to who can access contraceptives and why, things like that, but also in the process of informing policies and legislation, realize their rights, because many of them don't actually know that some countries have put in their legislations rights for the adolescents that then we don't see materialized into the programs. But important also is to hold the duty bearers accountable. That is something that adolescents also have the right to, according to this participation framework. Next. So when you put all this together, you will look at both the space, the voice, and the audience into a enabling socio-ecological framework where the enabling environment for participation is also part of. And then the outcomes for meaningful participation can then be aggregated into 3 groups: collaborative participation, consultative participation, and adolescent-led. And this is extremely important, I think. Next, please. When we talk about sexual and reproductive health. So voice and agency in all matters of sexual and reproductive health could be either consultative, collaborative, and actually, ideally, should be adolescent led. They should also, through this framework of participation, address or have a say in some of the social determinants of adolescent sexual and reproductive health, whether our gender norms, the potential for social influence, and the violence and harmful practices that still exist in many parts of the world, including prevention of child marriage. And some work that UNICEF is doing for the prevention of child marriage and many other organizations do actually include at least some consultative and collaborative sort of a participation of adolescents of both genders. But it's also important that they participate in the decision making associated with sexuality education, where the roles of schools, or even by knowing from adolescents where they would like to learn more or learn at all about sexuality education, would allow programs to be better designed in a way to respond to their needs. The role of communities in sexuality education, of course, this will be according to social norms and context. The role of social networks, but also very important, the digital, we are in the digital area, so social media and other digital sort of tools and devices that can be used to increase sexuality education. Next. So for low and middle income countries with a high adolescent birth rate, there is a huge economic benefit that has been put forward that you can see in the literature that can come from making contraception realistically accessible to adolescents. Um, uh, Improvements in access to contraception can lead to healthier, more empowered, and more educated young adults. So you can find that in the literature. Leads to decrease in fertility that then can help with the rapid population growth and decreases in poverty. And many of you have seen this picture where investments in adolescent girl, specifically in the very important areas or in the inflection points as they transition to adulthood, can actually make or break in terms of the ability for countries to harness the demographic dividend. And many organizations such as UNFPA and other advocates do use some of this to generate more interest and awareness with respect to investments in adolescents, but also the importance of linking that with demographic dividend. Next. So even though we know that governments have committed to prioritizing adolescents, most of them, different levels of commitment, but policy development and program implementation have not always supported these commitments in low and middle income countries. The unique sexual and reproductive health needs of adolescents often remain unmet. A lot of it because of lack of knowledge, social stigma, poor legal environment support, and policies that can prevent the provision of contraception and safe abortion, and a lot of judgmental attitudes among service providers towards young people. So in essence, there's quite a bit of evidence of what could be done and what can make a difference for, again, many instances in low and middle income countries, like continuing education, comprehensive sex education, wide use of contraceptives, even through universal healthcare for adolescent sexual and reproductive health. The sort of the importance of voice of adolescents in decision making, the abolishment of harmful practices, including child marriage, that is increasingly better over time, at least in terms of legislation, but also very important in gender equity that in many places touches in gender norms. So I am going to stop here so that we can have a little bit more discussion, and thank you so much. And I'm sorry, Johannes, that I actually didn't go into what you expected me to go over, that paper, but I think that you covered it absolutely well. And I wanted to focus a little bit more on adolescence. Thank you.